Okay, so before your discharge, it's important that we go over some information about your diagnosis, which is preeclampsia. And preeclampsia occurs when gestational hypertension is not stabilized and blood pressure is 140 over 90 or higher. Gestational hypertension has or can lead to preeclampsia if it continues to be not stable or under control. Excuse me. Common risk factors of preeclampsia are the age of the mother. If you're younger than 19 or over 40, you can be at risk. Pre-pregnancy chronic conditions such as hypertension, renal failure, or diabetes, and history of preeclampsia in the family. So those are all the risk factors. Some signs and symptoms of preeclampsia are persistent headache and irritability. Some may even notice, not always, but edema or swelling of the legs. Okay. So complications of so that's what you want to look out for. Some complications of preeclampsia are more severe conditions such as eclampsia or HELLP syndrome, where organs become compromised and seizure activity is present. While at home, it's important that you follow bed rest instructions, such as lying on your side in a dark environment. Take your medications as prescribed. Drink 6 to 4 glasses of water per day and avoid alcohol and smoking and foods high in sodium, or also known as salt. It's also important to limit caffeine. Now, it is okay to have visitors and to watch TV as a distraction while you follow these instructions on bed rest. If the headaches come back or a sudden weight gain occurs, it's important that you seek medical treatment right away. Okay, now that I went over a lot of information, do you have any questions? Okay. Just to be sure I covered everything, can you tell me what preeclampsia is? Great. And what should you look out for at home? Great. And what should you do if you do find those symptoms occurring? Excellent. It sounds like you're doing really great. And one last thing, what are your instructions for bed rest? Sounds good. Do you have any questions? All right, looks like you're ready to be discharged.